Well, good afternoon, folks, or at least afternoon if you're on the East Coast. This is Brandon with the National Minority Equality Forum here for our Friday webinar, and this one is super important. As you all know, I think we're 11 days out from our next from election day, and somebody told me election day ends. Make sure to tell you election day ends on November, not begin. So maybe you can start getting out the vote now and being a proactive member of your community, and that's why we're having this webinar on Vote for Your Health. I'm super excited about it. Thanks, one, Ashley, for the cool title. And two, thanks to Mia Keys for rejoining us. I mean, Mia is obviously one of our favorite, if not our favorite, moderator. And I think she started it all off back 4 years ago when we started doing these webinars. But Mia has since gotten a promotion, and she's now Director of Global Health and Innovation at Hologic. She's also past 40 under 40 winner. She was executive director of the CBC Health Brain Trust, chief of staff for Rodney Kelly, and she obviously works a lot with us at the National Minority Equality Forum. And this is an issue with that I think she's super familiar with. I've seen Mia give a sort of a talk about this very issue of how voting has impacted health through the years. And so she's joined by some incredible people, but I will go ahead and turn it over to Mia. She's the expert here, and she can help out with this.
Brandon, I really always appreciate being with NMQF, and thank you for the gracious introduction. This is obviously one of my favorite places to be in general, just wherever NMQF is, but especially on a Friday at noon EST time. And as you said, today's conversation is not only timely, but this is so very critical on so many stages, right? With respect to pretty much every walk of life. Voting matters, but when we're talking about health, our individual health, when we're talking about health of communities, and when we're talking about health of generations, the way in which we vote up until November 5th, thank you for that clarification, that point, is really the point here. And so we're going to just jump into our conversation, but first, before we do, I want to introduce our fantastic speakers and people who are just really very, not only bright, but impactful in their work and the way in which they show up in this world. And I couldn't be more proud to be joined virtually by Aaliyah Bhatia and Dr. Chris Ford. And I want to take time to just tell you a bit about them and encourage you to, during the talk, but then also afterwards, for those who are listening live and those who are listening on the various platforms after today's conversation, please be in touch with their work and their organizations. So Aaliyah Bhatia is the executive director of Vote ER and Civic Health Month, where she works to bring voter registration into formal healthcare settings, including emergency rooms, hospitals, community health centers, and so on. Aaliyah completed her master's in public policy from Harvard Kennedy School as a Sheila C. Johnson Leadership Fellow, and many of you know that name, or at least stay at very cozy spaces where Sheila Johnson has established lovely places. But anyhow, Aaliyah is also a graduate of the School of Foreign Service here in Washington, D.C., where I sit and where she sits. It's at Georgetown University. She was initially drawn to the connection between health and democracy through the combination of being both raised by parents in the medical field, as well as, and that experience being a defining experience and various other defining experiences while she was studying and teaching and working on housing and health-related initiatives. Aaliyah started her career as a high school educator, and then she became a strategic consultant at the Boston Consulting Group, and she prioritizes diversity and inclusion in all of her endeavors. It's core to all of her work. As I mentioned, she lives here in DC, where she works to realize Vote ER's mission of healthy communities powered by an inclusive democracy. But I'd be remiss if I didn't mention that she is a Georgia native. She's also worked across the U.S. South and in states including Louisiana, Alabama, Mississippi, and Missouri. Aaliyah, we're so excited to have you here today. Thank you. I'm sure she'll tell us all about, I'm sorry?
So honored to be here.
We're honored to have you, and I'm sure people will be asking about your various identities and what it means to show up in this work. I also want to introduce Dr. Chris Ford. He's an emergency medicine attending physician with vast experience working in rural as well as in urban settings. Dr. Ford obtained his med degree at the Medical College of Wisconsin, where he was a member of the AAMC's Organization of Student Representatives, as well as a member of the Student Surgical Society. Dr. Ford served at that time as chief resident during his final year at the University of Wisconsin through their emergency medicine residency program. And right now he is a practicing emergency ER doc and director of public relations of emergency medicine specialists in Milwaukee, as well as serves on the advisory committee member as an advisory committee member for Wisconsin's Emergency Medical Services for Children. He's also the chairperson of the People's Maps Commission, which I really hope that he'll highlight today. And Dr. Ford helped to develop through that work fair and equitable district mapping for the entire state of Wisconsin, which presents findings consistently to the state legislator. And Dr. Ford is engaged with various other community organizations across the Milwaukee area, including the AARP-sponsored Walk with a Doc program. And he also helped to co-found the Dyslexic Medical Professionals Group, which I think is fantastic. And finally, but certainly not complete to the work that he does and the work that he will continue to do, Dr. Ford is the founder and the host of a podcast called Pulse Check Wisconsin, which is a medical podcast for the people of Wisconsin. And if I'm not mistaken, that's the state of Wisconsin in the back of you. And is that also the Pulse Check Wisconsin?
Yep.
Frame there? That's really cool.
Awesome. Thank you so much, me.
No, it's my pleasure. I also really I really virtually like to look around people's rooms, and I think it says a lot about the work that you center, that it's literally front and center there. Absolutely. So let's dive into it. Aaliyah, I want to start with you, right? I want you to tell us, what is VOTE-ER? Give us a bit about your work in terms of how you approach your day-to-day, and what does the organization do, and what do you do for the organization?
Yeah, thank you, Mia, so much. It is an honor to be here. Before I dive into VOTE-ER, I just want to share a little of what brought me from originally being a high school educator into work like this. And I taught in post-Katrina New Orleans for several years. And in 2012, so I taught 11th graders, so 17-year-olds. In 2012, one morning, there was news that a young man named Trayvon Martin had been murdered by George Zimmerman. George Zimmerman had not been arrested. Many of my kids had family members who were incarcerated for just the whiff of potentially having done something wrong, let alone something as severe as what George Zimmerman had done. And so my kids come to school and are asking me as their teacher, why isn't George Zimmerman behind bars? And I didn't have a good answer for them. And as an educator, I'd come because I'd seen some of the examples of racism that had emerged and kind of become more visible to someone like me during Hurricane Katrina. And what I realized in that moment was that as much as I really wanted to make a difference in my students' lives, and as much as I was doing that by being a teacher, that if I really wanted to make a structural impact on their lives, I was going to have to go beyond the classroom and really make an impact on policies and laws that were shaping their lives. When I moved home to Atlanta, I hadn't yet changed my voter registration when George Zimmerman was acquitted. And I went to the protests the next day in Atlanta. And while I was there was a woman waving around a clipboard, and she said, you know, who here needs to register to vote? And it was one of the most hopeful things that I had experienced during that protest, because I was and so many of us were so sad and exhausted and tired and upset. And so when I got to register to vote in Georgia and then to vote in Georgia, it was something that made me hopeful in that moment. And a part of why I work at VOTE-ER is to help provide that hope to others of being able to shape our communities through the power of our vote and our ability to shape the policies that then go on to impact our kids and families all around the country. So that's a little bit of what brings me to this work, one of a number of different things, but I wanted to make sure to share that, especially given the moment that we're in, where, you know, your vote, wherever you are, up and down the ballot, is going to matter and make a difference to both direct health outcomes, but also questions like, what do stand our ground laws say about the access to guns in different communities, for example. So remember that there's both those direct health issues, but also those indirect ones. So with that, I'm going to share a little bit about VOTE-ER through a couple slides. We're a very visual organization, so I'll do this visually for you. At VOTE-ER, we register hard to reach voters using healthcare professionals as trusted messengers. Health professionals are the most trusted professionals in America at the time right now, with nurses having been the most trusted professionals for the last 2 decades. Our health professionals do this in many ways, and one example might be they might wear a badge that looks something like this. And with that badge, when they finish up the rest of their social history, they might, ask, do you smoke? Do you drink? Are you wearing your seatbelt? Are you safe at home? Last question, you just turned 18. Have you registered to vote? So we create this opportunity for health professionals to intersect with their patients around this critical question and to have the opportunity to explain to them that they want to be able to support their health beyond the clinical walls. And a great way to do so is to make sure that that patient is registered to vote and participating in the elections. What we know is that across global, national, state, and local data, when more people vote, you get healthier communities and you get more investment in public health resources. And one of our advisors, Daniel Dawes, who wrote The Political Determinants of Health and previously ran the Satcher Center at Morehouse School of Medicine, talked about how when you look at health-related social needs and social determinants, there's something upstream of that we have to move in order to shape those other pieces. Those are structural determinants or political determinants of health. And Daniel mentions that voting is arguably one of the most important aspects of those political determinants. Why? And I want to name, there's two reasons. There's one we usually think of, which is voting is how you select who wins. That's really important. But as you think about the next 11 days, I want to add in another piece. Voting is also how you hold accountable those people that you vote for. What that means is that when you're turning out to vote, there's going to be issues that you have with every candidate on the ballot. It is still important to vote because they are going to look back at the people who chose to cast their ballot when they decide whose voice they take into consideration when shaping policy. And so it's really important that we all vote so that we can be part of the accountability mechanism for our elected leaders in addition to selecting them. At VoteER, we work all across the medical and healthcare field, including with the NMA, the AMA, the Association of American Medical Colleges, all across the board to make sure that we can do this work with major partners. And we are now in about 700 clinics and hospitals all around the country. We're now at the point where I get texts from friends that are like, oh, I went to see my health professional and they had a VoteER badge. And it's just wonderful to be at that place of sort of ubiquity and growth across the space. And folks like Dr. Ford were amongst the earliest to embrace VoteER, and it's incredible to see how much we've grown and how much this acknowledgement has become something that is very central to the healthcare field. At VoteER, we try and make it effortless and fun for health professionals to participate in civic engagement. So, this is my badge. We try and make every one of our tools as fast and easy to use as possible. And then we, throw in a little bit of healthy competition. I hear medical students love some competition. So we'll make little leaderboards for different hospitals, for different groups of medical students, health professional students. Right now, I think Rush in Illinois is like at the top of our leaderboard right now. So everyone's trying to catch up with Rush, but we try and make it fun. We try and create some celebration around the work that we are doing. But we don't stop there. In addition to individual health professionals, we know that health professionals are carrying the world on their shoulders. We know that particularly in the wake of COVID, there's been this feeling of, everything falling on the weight of our health professionals. And we want to make sure we're working towards systems that support people to have their voices heard so that it doesn't just have to get done in spaces like health professional spaces or other spaces where voter registration is done. So recently, we worked over the last 3.5 years to get Health and Human Services to put a voter registration question straight into the healthcare exchange. Because if you think about normal places people register to vote, they get registered to vote at their Department of Motor Vehicles. That probably means they have a car, right? So there's an automatic determinant around wealth that is impacting our normal voter registration spaces. Let's make sure that other spaces like healthcare.gov, like Medicaid, are also places where people are being asked about voter registration so that we can account for the folks who may be missed out by that Department of Motor Vehicles approach to registering voters. And through this, 66% of the voters we reach are under age 35. 39% of who we reach are voters of color. So we reach a far more diverse group of voters that are normally reached in the electorate, much closer to the actual composition of our country, in being able to turn people out. And the other important thing is that it works because health professionals are deeply trusted. When you look at our turnout, which is the dark blue, and compare it to the light blue, which is general turnout in the voter file, you see that across the board, particularly with young voters and voters of color, the VoteER turnout rate for voters of color, as well as for young voters, is significantly higher than the turnout rate in the general voting public, up to 17% for young voters and voters of color. So we really strive to make sure that we are doing this work in a way that supports the agency and trust of folks most marginalized by our democracy and by our health systems. So what can you do? There's some big dates coming up. Next Tuesday, mark your calendar. Next Tuesday is Vote Early Day. As Dr. Ford has mentioned already, I think on this call, the last day to vote is November 5th. It's not the first day to vote. So I want to make sure that everyone marks their calendar for next Tuesday as a way to activate earlier. And on this next page, I'm going to give you a resource to do that. I'll drop all of these in the chat in just a little bit. But we've got a link that will give you a ready-made email to send out to your staff on Monday or Tuesday of next week, encouraging them to make their plan to vote. As I mentioned, every tool and resource we use is the best that we can find. It is nonpartisan. Our team works across all the different states where our team is virtual, and we have tested all of the resources that we provide to you. So this is one tool. A second thing I want to name is if you're, like Aaliyah, I really want to make sure I'm doing something in these next 11 days, and I'm feeling a little anxious, and I really want to make sure that we have as high voter turnout as we can. Join us for Get Out the Vote phone banking. We call the folks who we have registered to vote with nonpartisan phone calls, helping them make sure they know where and how to vote. I was just talking with an Indiana voter yesterday, and we helped find his early vote location so that he could show up early and go vote before the election, because that was more flexible and convenient for him. So this is another piece of what you can do over these next couple days. And then lastly, yourself, I'll drop a link in the chat that you can share with others. Again, we try and pick the best resources. Our resource for making a plan to vote is the same resource that Google uses. If you try and sort of type in like make my plan to vote on Google, it's the same resource, and we vetted it very extensively to make sure it was the best possible resources we could provide. So I'll shortly drop all three of those links in the chat. But before I do that, and before I hand it over to Dr. Ford to share a little about his experiences talking with patients about the importance of voting, I just want to make one important thing clear. I mentioned that I was a former school teacher, and so I think that's going to play in here. In 2020, in the US, we had record turnout, the highest turnout we had seen in a century, the highest turnout we have seen since our modern voting laws enfranchised communities of color, for example. And in that time period of making sure that we had high voter turnout, in 2020, 2/3 of people showed up, so 66%. I am a former educator. 2/3 is a failing grade in most schools. Sometimes it's a D. So our record turnout still excludes 1/3 of eligible voters from our community of voices. We need to fix that as a country. We need to make sure that we're setting a higher standard for what it looks like to have that record turnout so that more people's voices are heard in shaping our policies. And it is showing in the crafting of policies. And you can see that a direct link in how we are spending resources and how we are choosing who to support and serve. And so I ask you, alongside Dr. Ford and Mia, that you really make sure that all the people in your world go vote in this election so we can set that new record. And so with that, I want to hand it over to Dr. Ford, who is one of our earliest health professionals at VoteER, but has gone above and beyond to champion the democracy movement.
Awesome. Thank you so much, Aaliyah. Thanks for having us here. I appreciate the introduction and appreciate the opportunity to be here. And as Aaliyah said, VoteER, I believe it was created in 2019, correct? Aaliyah, is when the first pilot came out. And that was right around the time where I found out about it through social media, looked more into it, and actually got my first badge right around that time as well. And to be honest with you, initially, just like anyone else, especially around the time of the most contentious elections that we're dealing with in modern days, I was a little bit apprehensive at first because I thought, what are folks going to think? Are they going to think that I'm trying to sway their vote to one side or the other? And nothing could have been farther from the truth. On a daily basis, I have my badge backer in place, and it peeks out a little bit from my normal badge, from my hospital badge, and it'll say, "Are you ready to vote? Are you ready? Are you registered to vote?" Right? And people will see that, especially when I'm walking in the room initially. And if there's any downtime in my patient interviews or patient interaction, I'll walk up to people and I'll say, "Hey, do you have a plan to vote?" And inform them that this is not anything that we're trying to get you to vote. I'm not trying to tell you who to vote for, I should say, but we just want to make sure that you're able to have that political activity, able to have that civic duty available to you, and know what the dates are and know where you can vote. I'll share a quick story. Recently, last week, here in the state of Wisconsin, our electronic or our virtual registration date had passed, but before that, a lot of my patients didn't know about it, right? And even some coworkers that I work with didn't know that. And so I was interacting with a patient here. She came in. Fortunately, she was not as sick as some other patients that I had been seeing at the time because I'm in the emergency department again. And so she asked me how long tests were going to be, how long, were her images going to take in order to be read. And I said, it'll take about an hour or so. But in the meantime, do you have a plan to vote? right? Because at that point in time, she was like, okay, well, I'll play on my phone. I said, well, while you're there, let's talk about, where's your voting location? Do you know where you're voting? Have you voted recently? And this was going to be the first election that she had ever voted in, which is powerful, right? And which is what we hear over and over and over again in the state of Wisconsin and throughout the country. And so she was able to look at my badge backer, was able to scan the QR code, and she registered herself while she was in the room, right? While she was waiting for those test results, right? And this is something that I share with a lot of my colleagues in healthcare throughout the state. This is something that, folks may or may not have on their radar, right? They may or may not have the plan to vote, but they want to be active. They hear the political ads online. They know how important it is. But for some people, because of work and life balance, because of their jobs, things of that nature, they don't think that they have time to do these things. And so not only were we able to register her, we were able to, find her location to vote, and she was able to vote early. I actually just saw her a couple of days ago out and about, and she told me that she had already voted on the 22nd, the first day that voting was available, early voting in person was available here in the state of Wisconsin. So for anyone out there who is apprehensive to do it, if you have those same sentiments that I did in the beginning of the process, know that there is nothing simpler than this process. The Vote ER badges, the Vote ER program is sanctioned throughout the country. It is well known within the majority of our hospital systems, our larger hospital systems too, that this is nonpartisan work and that this is making a difference. We have registered already thousands of patients throughout the country who otherwise may not have showed up. They may not have had a say in their communities and the way that their policy is being shaped and the way that healthcare policy will affect their health and going forward. So that's going to make a tangible difference. And I urge everyone here who is interested to definitely look more into Vote ER and to do, like Aaliyah said, all the best that they can to get a friend, get a family member, make sure everybody is involved, because not only this election federally, the local elections are paramount in shaping your health day to day. And we'll talk a little bit about that in my presentation now. So I'm going to try to do this. Now, this is 4 years into the post-pandemic life, and so this is my first sharing of screen. So I'll warn you here. So let's
There's
see
grace
here.
and space in this virtual space.
I
Chris.
appreciate you.
Good. And as you're doing that, I want to encourage our attendees to drop any questions you might have in the Q&A box, and we will get to your questions while we're interacting. And any comments you have, please make sure that you're talking with one another even in the chat.
Let's see here. Let's see. It's not allowing me to do it on my end. Huh.
If you make your screen bigger, do you see the share button at the end, at the bottom?
Yeah, let me see here. Google Chrome, unknown. Let me see. Share. It's telling me allow workspace to share your screen. Open system settings is what I'm trying to do here.
As Chris is doing that, Aaliyah, do you want to tell us more about what happened? Like, at what point did you all develop the interactive badge? Where did that come in the process?
Yeah, so funny enough, I was visiting, of all places, Milwaukee, Wisconsin, during the beginning of COVID. So I was helping set up our clinic in Milwaukee, and on March 11th, COVID became a pandemic, and I went home, quarantined in my parents' basement. My boss, Dr. Alistair Martin, is an ER doctor in Boston, and he was working in the ER, and he was experiencing that so many of the patients coming in and having to be put on ventilators were disproportionately Black and brown. And the week after the first day of spring, we hopped on a phone on Sunday. We got together on the phone call, and we were like, well, the way we were doing this 2 weeks ago, we can't do it this way. It's never been more important. And with that, we were like, well, what can we do that doesn't, our previous work had been a kiosk. So you like go and touch a iPad, beginning of COVID, we're all like, well, can that iPad transmit, so we were like, what can we create that doesn't require anyone to touch anything? And that was a little bit of what the badge was intended to do, was create a touchless mechanism where the patient is using their own phone. So that's how we came up with the badge. Yeah.
And does it populate in different languages?
Great question. all of our tools and resources are available in both English and Spanish. So
Fantastic.
everything is in English and Spanish.
Mhm.
We have not figured out a way to be able to consistently support other languages.
Mhm.
What we do is when we work with, say, a clinic that might serve a predominantly Haitian Creole speaking community, we will provide the versions of our work that are editable and let them do a translation in-house, so that they have that available to them. So that's the way that we've been working with folks like that. We're actually hoping to invest a lot more in language justice next year as something that is a priority for us. So.
And I love that you're building on that. It could be that there are people who are listening today or will listen later, and they themselves have capacity through whatever platforms they're working at to potentially work with you. So that's also another really fantastic thing about working on, working together and being a part of this NMQF platform.
Yeah,
Mm.
absolutely.
We're going to get Chris together.
Yeah,
But,
sorry.
no, you're good. Hey, listen, again, grace and space in this virtual place. That's what we are all about. I think Ashley is also going to help us out.
Okay.
Let's see if there are any questions from the audience just yet. We're still waiting on some questions if you have them. But otherwise, Aaliyah, tell us a bit more as we're getting Chris's slides together. Tell us a bit more about how you all go about recruiting the actual physicians, because I imagine there are a lot of physicians and healthcare providers who don't necessarily or have not ever really thought that what they do is an extension of the civic process, or that civic engagement is a part of healthcare.
Yeah. So let's talk about some of our biggest cohorts of health professionals. Our biggest group is pediatricians. If you are a health professional and you're treating a young person who comes in with asthma, kid didn't do anything to get asthma. Probably a politician allowed there to be a bus depot in the backyard of that home, right? And so like kid has asthma because of political choice that was made. So when we talk with health professionals, one of the things that they crave is a way to make a sustainable, tangible impact in their patients' lives. And, I think at this point, many in the health field have sort of acknowledged that some huge portion of our health, up to 80%, is not going to be determined within clinical walls. So how can a health professional make an impact on that? And so our work has been particularly appealing to those health professionals where the thing that they are seeing or experiencing when their patients come in is something that maybe if they could go upstream of it, that they could make a bigger difference. And there was a health professional, we were doing some like qualitative interviews of our community, and a health professional a few years ago said this marvelous thing, which was, I went to medical school to be able to study how to make a difference in my patients' lives. And what I found was that toolkit was actually very constraining for me. I wasn't able to do the work I wanted to do. And I really felt that when Vote ER came into my life, that it created the opportunity to make the type of impact that I wanted to be able to make. So how do we then sort of share our work? We go to health professional conferences. For example, I was just at the National Association of Community Health Centers conference last month. We spend time with medical students across the country, help share about our work in orientations of medical school, in medical school curriculums. So that's a little bit of how we spread the word about our work. So,
and there's a question in the chat about the role of healthcare administrators.
Yes, let me see if I can see the question. 1 second. Open question. Yeah. Oh, love this question. Thank you. So this is a fantastic question. What we do for healthcare administrators is we provide a set of resources that you can use throughout a hospital or a clinic. So for example, we're a health association. Let me give examples at each level. Clinics. Our community health centers actually text their patients nonpartisan texts reminding them to register to vote. And so, for example, you might have a community health center that sends something next Tuesday that says, today we're celebrating National Vote Early Day because voting is a part of our health. Make sure you know where to vote. And then the link that I just shared. That's what clinics can do. At the hospital level, we offer examples of how to integrate voter registration into your after visit summary and electronic health records. Actually, one of my best friend, her mom unfortunately was hospitalized in Philadelphia. And when she got the paperwork, she took a photo and sent it to me and said, look what I found. And it was the Vote ER sort of QR code reminding people to vote as a part of their discharge process. So that's another example. And then for health associations, folks like the American Medical Association, the American College of Obstetricians and Gynecologists, they will send out notes to their communities that have either a reminder for them to register to vote, or the language of an email that they can then send throughout their health organization. So providing those templates and resources to others. So those are a couple different ways to engage as an administrator. And in the links that I dropped in the chat earlier, I'm going to drop one more time the one that can help your community get ready for Vote Early Day, because I think that is an example very directly to how you can help.
And so I used to work for the American Medical Association. I helped to stand up the Center for Health Equity. And that's exactly what we did. Once you sent us a template, it was certainly, put out, especially to our medical students. They were particularly engaged in the conversation of links between health and civic engagement. And shout out again to Daniel Dawes, who is a huge friend of the National Minority Equality Forum. And for those of you who haven't read his book, or at least several of his books, but particularly the one that Aaliyah mentioned at the top of her presentation, it's the Political Determinants of Health, and it will certainly give that background. And I think that also gets at the spirit of another question, which someone put in the chat, which is, what does the training process look like for healthcare providers and so forth? And so Aaliyah, if you wouldn't mind speaking to that as well. And what I would also say is, for those who are interested, please read books like the one Daniel Dawes wrote.
Yeah. So we at VOTER are all about making sure we have multiple ways to learn something. So this first example is what I'm going to call the bite version. So we have bites, snacks, and meals. So at VOTER, what we try and do is make sure that we right size the amount of information that we're giving to support anybody. When you request your VOTER badge, you will receive an email series training you on how to talk to patients about voting, preparing you for that process, including little training videos, including little conversation starters, and a link to this conversation starters page. So that's sort of the bite example. The meal example could be, or the snack example, excuse me, could be that you come for a 1-hour training with us that we offer on a monthly basis, and we actually put you in breakout rooms to practice with others. And then the bigger version could be that, you are actually leading a team at your organization, and y'all are collectively practicing and working on this together. So a bigger commitment, but also a deeper sense of understanding of the material. So we try and provide it so that anybody, whether they just gotten a badge, et cetera, all the way up, that they're going to have that capability and ability to talk with patients about voting. So really great question. For the conversations linking health and voting, health professionals are busy. And so typically we simply have them ask it as part of the social history. But if then they're asked back, our recommendation is that if someone says, well, doc, why should I vote? That the person should actually just respond with authentic personal story about why they vote, and sort of individually share it and share that connection. And then the other thing that they might throw in is the American Medical Association has named voting a determinant of our health. And just like I want you to wear your seatbelt, as the guidance says, I also want you to vote. So those are some of the different strategies that we use.
And again, thanks for dropping all of that, all of the links in the chat as well. I'm going to bring Chris back into the conversation. Chris, we want to hear from you and walk us through your slides, please.
Yeah.
And give me just a few moments to bring this up.
Awesome.
Here.
Perfect. Okay, we can go ahead and click through that first one.
Oops.
Thanks so much, Mia, for your help with this. Uh-oh.
My bad.
Good song. That's let me tell you, top 5.
Hold on just a moment. Let me zoom out. Oop. Goodness gracious. Are these
yeah,
my, these are my, this is my screen, isn't it?
Yeah.
I'm using.
Yeah, just back to the slide. There you go.
Goodness
Perfect.
gracious. Sorry
Perfect.
about that.
That's okay. That's all right. So go ahead and click. I think if you click straight through that just is there we go. So so what we'll do is we'll talk a little bit about how voting affects the health of our communities. Again, I'm Chris Ford. I'm an ER doctor here in Milwaukee, and I want to talk to you a little bit about like why I got involved in civic activism here in the state of Wisconsin and in Milwaukee. And a lot of that has to do about what Aaliyah was talking about too, the power that voting has on our individual populations, and not only voting, but actually having the ability to have your vote count and have the electorate choose their elected officials and not vice versa. So we can go ahead and click the next one. So this is a map at the very beginning of the pandemic, like we brought up at the beginning of this. This will be a recurrent theme. But in the city of Milwaukee, what we saw was throughout the distribution of the north side of Milwaukee as well as the south side of Milwaukee, we saw the highest levels of COVID prevalence at the very beginning of the pandemic. So that's increasing numbers of death, bad effects of it, so morbidity and mortality, as we say in the medical societies. But the interesting thing that you see in this heat map is it can be interspersed with a lot of other social determinants of health that we talk about commonly, lead poisoning, asthma, as we discussed as well, too. The amount of prevalence that we see in these populations is skewed, and a lot of it has to do with the social determinants of health that we'll talk about a little bit as well. So we can go ahead and click to the next one. So this is an article right from the very beginning of the pandemic. This was had a quote from a friend of mine, Representative David Bowen, who was a representative in Milwaukee at that time to the state assembly. And what he talked about was just that, right? African Americans who were living on the city's north side were being particularly hit harder than any other demographics. And a lot of that had to do with disinformation, misinformation as well as limited access to care, which has helped spread it. It didn't cause these issues, but it made those scars bare in the setting of the COVID-19 pandemic that we had. So we can go to the next one. So what we saw was this is disinformation, right? And so this is what we saw that was combating a lot with what we were trying to do in the hospitals at the time. You saw a lot of fake posts that were on Twitter at the time, now X, that, and this one in particular was one of the more egregious ones, that African Americans were immune to COVID, right? And so you had a demographic of folks who were out and about saying, I don't need to do this, shelter in place. When the vaccines came out, I don't need to do that, because we thought, at that point in time, this disinformation, in some cases, people thought it was true. And we were seeing the reality, which was on the right, that there was an increased rate of prevalence and an increased rate of deaths that we were seeing disproportionately here in Milwaukee and throughout the country. We can go to the next slide. So it kind of left me with, how can I affect change? And I was a part of a cohort of doctors in the state of Wisconsin that would reach out actively to members of the legislature to try to see if we can get assistance to the hospitals, to try to get it in the minds of some folks who are making this policy decision that this is something that is affecting us disproportionately here in Milwaukee. We need help. We need to help get the message out that this is something that's dangerous. And we were met by a lot of resistance, especially in the very beginning, from some of the more conservative members of the legislature that, in one egregious example, told me I was blowing everything out of proportion, that he wasn't seeing in his community, so it must not be true, right? And so that kind of left me with, how can I further this? How can we go the next step? Because in Wisconsin at that time, we saw maps that were egregiously gerrymandered, which means that a portion of the electorate were taking the maps and cutting them in certain ways in order to increase their influence on that map. And it was not reflective of the will of the people, especially folks who were most affected by it. We can go to the next slide there. So gerrymandering, we don't have to go through this video, but gerrymandering, as we discussed there, was more so what was on the table. And in 2020, we had the opportunity to redistrict. Every 10 years is when redistricting occurs in every given state. But we had the opportunity in Wisconsin to do it the right way this time. We had been at that point under gerrymandered maps for 10 years, meaning, again, that the electorate was not choosing their officials, and the officials weren't beholden to the will of the people in the majority of states, of neighborhoods and communities that we saw. So we can go to the next one. So the governor of the state of Wisconsin, Tony Evers, and at that time, Lieutenant Governor Mandela Barnes, created an executive order that put in place what was called the People's Maps Commission. And the idea of the People's Maps Commission was to create fair, nonpartisan redistricting maps in order to prioritize the will of the people and to make sure that those votes would be counted in a way that folks would have to listen. The representatives would have to listen to the people of the state of Wisconsin and what their communities wanted. This was very similar to the goals of Vote ER, in that this was a nonpartisan mission, right? There were people on this commission who were Democrats, were Republicans, independents as well. And we looked at the facts and we looked at the will of the people and how they wanted us to draw those maps. We held congressional meetings and hearings in each congressional district. And the entire process took about 1.5 years in order to complete, until we were able to present to not only the legislature, to the governor's office, but also to the Supreme Court eventually, our maps and our findings and how those maps would affect our populations. So we can go to the next one. So these are all the commissioners. Again, there was a representative, 2 in my district, but 1 in every other district, given the size of people throughout the state of Wisconsin. They were representative people. We had doctors, we had CEOs, we had teachers, we had people from all walks of life. Jason Bissonette, who is top middle there, is a representative out of the 7th congressional district, who was a part of our Native American population, who was able to provide some context as well for things that his district wanted as well. So we were truly representative, and again, from all walks of the political spectrum and the socioeconomic spectrum as well. Go ahead to the next one. So this got kind of national recognition. So we had Eric Holder that came out, former Attorney General, who spoke to us about the power and about the importance of fair maps throughout the country. And in that, we were able to have expert opinions come out from nonpartisan walks of life, from national redistricting efforts, in order to help provide us with not only the concepts, but also how mapping could be done and how we could draw these maps to make them more equitable and to make them reflective of those populations. We can go next. So in the state of Wisconsin, we have 8 congressional districts. There are 33 Senate and 99 Assembly districts. And so what we were able to do was we were able to create our maps not only to comply with the parameters of our state constitution, but also to make them as reflective as possible. We can go to the next one. And what we see in this next one is this was an independent assessment that was done of our maps, which are on the left, as compared to the maps that eventually became law of the land, as we'll discuss later, temporarily. And this was through the Princeton Review. And what Princeton was able to do is they were able to say that our maps had an objective partisan fairness grade of A, as compared to the maps on the right that you can see that had a significant advantage for one party. And so we were able to reflect that. We were able to use all of the testimony of all the individuals that we were able to get that from in all the districts in order to put that into our maps and make them more reflective and make them fair. So we can go to the next one. So as politics goes, in Wisconsin around that time, there was a conservative majority in the Supreme Court, the Wisconsin Supreme Court. And so there were 4 conservative judges that ended up voting against our maps. And what they said was they wanted to make the maps least change as possible. And by saying least change, that meant that they were less fair, and that it was gerrymandering 2.0. And so what happened was our maps, because of that ruling, were temporarily thrown out, even though all the data was out there and we had all of our information out there for anyone to view. And they ended up going back with the maps that they had from the Republican legislator at the time. We can go to the next one. But as political will goes and as elections go, in April of this year, we had Justice Janet Protasewicz, who was voted in to our Supreme Court. And then we ended up swinging it away from that conservative majority. And it was able to go back to the Supreme Court, and it was voted to be unconstitutional, that least change approach. Again, it was gerrymandering 2.0, and folks did not have the ability to vote and have their vote actually count, because their representatives did not have to be beholden to what they had to say. So we can go to the next one. And so what happened was maps went back to the governor, they went back to the legislator, and they were forced to work together under this new ruling by the Supreme Court. And the governor's maps ended up being the maps that were pushed through the agreement between the legislator as well as the governor. And who knew, the map process that we used through the People's Maps Commission was the same process that the governor used. We already had all that information. So the maps that the governor ended up pushing out were very reflective and looked very much like the maps that the People's Maps Commission were pushed out. And so that is now the law of the land. We now have fair and more equitable Senate and Assembly district maps in order to vote for the first time in 12 years in the state of Wisconsin. And so that means there's going to be more competitive elections here in the state of Wisconsin. That means that our voters here are going to have the right to vote and actually have their vote count in that way. And so a lot of folks in the state of Wisconsin, being a truly purple state, are very hopeful with the change that can be made, and actually the laws that can be pushed through, and we can address some of these issues that we have as a state. You can go and push through. And so what we say here is this is, as we talked about before, me talked about the podcast that I do here. We talk about this and we talk about a lot of other things here in the state of Wisconsin too. We had the governor on himself to talk about our nursing shortage. And we also had my esteemed colleagues from Vote ER on episode 5, where we discussed the power of Vote ER and the power of voting and having our patients have their voices heard on a normal basis. And so what we'll do is we'll put the QR scan here. If you guys want to do that, I will also put a link in the chat as well. If you guys want, it's on all streaming services. And we're looking forward to speaking more. All right.
I don't know if you all hear the music. Do you hear the music or am I? You do. Okay, making sure I'm not the only one who's bopping.
Wait a minute.
Give me just a moment to now I'm like really jamming. This is your fault. Chris, that was so very insightful. Thank you so very much for walking us through that. I'm wondering, if we can pick up on some of you gave us a lot to think about and a lot to consider. And congratulations and thank you for the work that you're doing in Wisconsin in relation to actual appointed officials. This is the role of physicians in so many ways. I'm wondering if you can tell us, both you and Aaliyah can talk to us a little bit about, well, there are two things, right? I'm wondering if you both can talk to us about the actual role of partisanship, right? Because you did mention toward the end there that with the new redistrict maps, with, having overcome the impact of gerrymandering, at least right now, and reversing what's happened in the past, what do people mention to you about partisanship? And then also one of the slides that you had in there, Chris, talked about misinformation, right? And so especially during COVID, during the height of COVID, and then even now, leading into an election, a critical election, we hear terminology, misinformation, disinformation. Talk to us about what each of those terms mean, why they matter to this discussion, and what it is that you all do with respect to eradicating misinformation or disinformation. So partisanship and mis or disinformation, please.
Chris, you want to start and then I go, or?
Yeah, you feel free to start off. Yeah.
Okay. So let's take both of those different pieces. At Vote ER, we're a fiercely nonpartisan organization. Partisanship has no role in our work. But what that doesn't mean is that, we're going to ignore civics, right? The idea that we have the power to shape our common destiny. So at Vote ER, we do everything we can to keep partisanship out of the game while still empowering people to make an impact on their lives and their communities and the policies that shape their lives. And we do that in 3 ways. The first is that since the beginning, Vote ER has had a bipartisan advisory council. The former chair of the Republican Association of Secretaries of State is a Vote ER advisor, has been from the beginning. He just published an article in USA Today about Vote ER that I'll drop in the chat. That's really incredible. And we also have the former Secretary of State of Connecticut involved in Vote ER. We work actively with both Republican and Democratic Secretaries of State, current Secretaries of State across the country. When you talk to those different folks, some of the things they might prioritize look slightly different, but ultimately it's all towards the same end, which is making sure that every eligible voter can cast their ballot. When you talk to somebody who might be right of center, the lens they might look at it from is when people move, they want to capture their updated information about their voter registration, make sure they're registered in the place where they are actually based in community. Vote ER helps us do that by making sure it's not just a once every 10-year visit to the Department of Motor Vehicles where you change your voter registration, but more frequently because you're doing it as you interact with the healthcare space. That might be a right of center perspective. And then a left of center perspective might say, we just want to make sure that everyone is able to engage our process. And, that left of center perspective might notice that if we look at who is registered to vote, it tends to lean to those who are higher income, those who are white, for example, and that Vote ER helps level that playing field. So we have something to offer to both perspectives around this. So that's the first piece, is we have a bipartisan advisory circle, and there's bipartisan reasons for wanting to do an intervention like Vote ER to help people register to vote. The second thing is that we are so laser focused on providing tools that are completely neutral and nonpartisan. 2 weeks ago, our team sat down, 6 of us from 6 different states, and we vetted multiple different versions to find which one had the most accurate information, the most nonpartisan information, and was the fastest to use. So we were constantly screening for that. We have kicked tools off our site where we find that they start to have a partisan lean, or we're nervous that the text they might send our patients suggests a way of thinking about things. So we are very, very rigid and strict about that to make sure that we can protect our community health centers and our hospitals who work with us, who have to protect their own 501c3 status. So that for us is a non-negotiable. And then the third thing I just want to name is the research about the link between voting and health is extremely agnostic to party. The research between voting and health says when more people vote from more backgrounds, political leaders spend more time caring about what those people need and therefore invest in public housing, public health, high quality education, making sure there's clinics in every neighborhood. Those are the types of things that get done. And that is agnostic to whether the person you vote for is a D, an R, a magenta party, you name it. And a lot of the global research in particular, it particularly demonstrates that it's agnostic to political party. So those are some of the 3 dimensions around that question. Chris, anything you want to add on partisanship? And then I can talk a little about the disinformation sort of landscape right now.
Absolutely. And so, in any redistricting efforts, it should be known, and it was our motto at the People's Maps Commission, that gerrymandering is wrong regardless of who is doing it. Right. And so there are examples in the country where Democrats gerrymander. There are examples in the countries where Republicans will gerrymander too. Right. And so it's wrong regardless of who is doing it. But it's one of those things in any terms of redistricting where you have to consider partisanship because it's different from efforts like VOTE-ER. Right. However, it is imperative that if you're on any independent commission, and there are independent commissions throughout the country where this example has worked, for California, for instance, where you take that partisanship and it depends on where you put it, right? And so in our mapping, in our process, we had criterion in which we would consider things that we found most important. So contiguity, which means that your communities are not being cut like a cookie cutter. Your neighbor across the street lives in a different district than you do, right? That doesn't make too much sense, right? Compactness and preserving those political boundaries. We also had a higher criterion of communities of interest. So if you have characteristics in common with folks from a religious background, et cetera, those are criteria that we want to keep in place because that is your community. Those are folks that you identify with, and those are populations we want to keep into place. We wanted to make sure that we had as least amount of population deviation, meaning that we don't have one district next door to you that has 2,000 or 3,000 more people in it than you do, so that your vote would not count as much. And then at the very end of that spectrum, we had in our criteria partisan fairness, right? Where we took a look after we had already created our maps to see where the skew was, and that had absolutely limited effect on any of the maps that we did. So whereas it is a consideration that has to be taken into account from a constitutional perspective and from a federal law perspective, it is all dependent on where you put it. And in our maps, we did it as fair as we possibly could.
Do you find, Aaliyah, before I also bring you back in the conversation, do you find that Wisconsin is a model for other states? Or are you having those kinds of conversations?
Is that to me or to Aaliyah?
Well, to initially to Chris, and I want to bring Aaliyah in the conversation.
Yeah, so any election runs through Wisconsin. Any federal election runs through Wisconsin, and that is well known. That has been well known for a long time. And so as goes Wisconsin, goes the rest of the country. And so I think that Wisconsin is at the forefront of any policymaking. We're at the forefront of any political activity. And the things that we do here are very reflective of those around the country. And so we knew that in going into this process, that what we are doing here and the model that we are creating here is a model that should be replicated throughout the country. We know that when you have any partisanship and when you have elected officials, mind you, none of our commissioners were elected officials, we know that that will skew people into one way or the other in terms of making maps fair or unfair. And we know that unfair maps unfairly affect people who are most affected by social determinants of health and that have the least amount of political will and the least amount of socioeconomic, most amount of socioeconomic strains on them at the time. And so we knew the levity of that, and we still know that in going forward in all the efforts that we're doing here in the state, including trying to get the most amount of people out to vote as possible, because Wisconsin is paramount to national policy.
You hit the nail right on the head. Aaliyah, your thoughts?
Yeah. For us, I would say some of our earliest dialogue and partners in our work was actually with Wisconsin health professionals like Dr. Ford. A few UW health professionals, for example, definitely feel that the work that is happening there is helping shape the rest of the country. And there's some real, UW Health is doing some really fantastic leadership around the sort of range of different ways they're engaging people around voting, and we're really grateful for the work that they're doing there. I want to spend a couple of minutes on the disinformation question, and it's in part because as we draw closer to the election, there are so many good people doing so much good work out there. There are so many good people getting out to vote. Unfortunately, lies are more contagious than truth, and we have to acknowledge that as a part of what we're navigating as we head into these next, 11 days. And in addition to lies being more contagious than truth, we also have algorithms in our different social media that sometimes make those lies feel bigger than they actually are in reality. And so I want to address a couple of things. I think one is very important to this particular community for NMQF, and then one is more broadly applicable to the whole country. They were both applicable to the whole country, but I want to talk, very directly about two of the things that we're seeing in the disinformation space that you each can help prevent against and support with. You can do that by making sure, like I've done it in my family group chats of like, family doesn't let family spread lies about other people is sort of a thing. And so the first one I want to talk about is how we talk about people of different backgrounds voting. And one of the things that has happened recently is that there are tropes going around certain types of people voting potentially being suspect in their ability or capacity to vote. That is straight up racism. Like it is essentially saying that we're going to question a person's eligibility to vote based off of their name, the color of their skin, etc. It harkens back to Jim Crow. I just want to ask everyone in this room to have zero tolerance for that type of language. There are excellent safeguards that prevent a person who is ineligible from voting, and it is so rare to be negligible. What did I tell you before? 1 in 3 eligible Americans did not vote in 2020. 1 in 3. In the meanwhile, we have these single-digit numbers of folks where accidentally they may vote when they're not supposed to. That is a non-issue in this country. So just want to name that. And if ever it comes up in a conversation that you're in, we've been collaborating with our friends at Unidos US and other organizations. And what they talk about is a truth sandwich. Start with a truth, point out that there's something going wrong that is being deliberately done, and then end with the truth, right? And our democracy, as everyone on this call knows, and as our ancestors and our families know, that our democracy works best when every eligible voter can go to the polls without fearing that their vote will be questioned because of how they look or what their name is. But there are folks out there who are trying to make us afraid of our neighbors and to question eligibility based off of that. But that's just not how democracy works. And it turns out that 8 in 10 Latinos in this country are citizens eligible to vote. They are legal citizens and should be empowered and able to vote. And so we all need to get out there and vote with our hearts, vote with our conscience, because it's our legal right. So that's what a truth sandwich looks like, is putting the sort of values and truth pieces on either side, but also naming in the middle that there is a problem, a challenge that we're up against. So that's one piece that I wanted to share. And then the second piece, and I know that Chris probably experiences this very viscerally, which is our elections are safe. Whether you are in a state that is being governed by a right of center Secretary of State, a left of center Secretary of State, a magenta Secretary of State, these folks are working around the clock, crazy hours, to ensure that every vote is counted, that this election is fair, that there is transparency around it. You got stories on LinkedIn of elections officials putting up plexiglass in their counting spaces so that a person can literally come observe and check in on kind of the process of counting the vote. So much is being done to protect our vote, and we need to make sure we support and encourage these folks. I've been on calls where I'm from Georgia. Folks in my home state are experiencing death threats for being involved in making sure that every vote is counted, and we got to protect those folks. And the last thing I'll say, because I know we're up against time, is democracy takes time. It's going to take time to make sure that every vote is counted. When you see something called in the media, that is the media making a calculation that that state can only go one way. That is not an official result. And what I've heard every Secretary of State across the country, regardless of which state they're in or how definitive their results are likely to be, to say is, please don't consider it final until the Secretary of State says so. And that is a way that every person on this call, in your WhatsApp groups with your families, in your communities, in your organizations, if we can hold that line that the election isn't final until secretaries of state have said that it is final, that is a really important way that we can support out there. So thank you all. Just grateful to be able to share the space with you at such a critical time.
No, this has been such a phenomenal discussion and truly enlightening for everyone involved. I am very grateful to the both of you, Aaliyah Bhatia, Vote ER, Dr. Chris Ford, emergency medical doctor, and also podcast host of Pulse Check Wisconsin. Please look into the work that both of these individuals are doing within their realms and also together. And should anyone have any follow-up questions that you weren't able to post here, please be in touch with National Minority Equality Forum, and they could certainly forward your questions to the virtual roundtable. I thank you for your time. I hope and pray that each of you remains hydrated, for one, and blessed by whatever powers be that you upon which you call, and continue to do the work that makes the difference for lives today and lives to come. Thanks so much.
Thank you.